This is Dr. Ben Weitz with the Rational Wellness Podcast, bringing you the cutting edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drweitz.com. Let's get started on your road to better health. Hey, Rational Wellness Podcasters. Thank you for joining me again today. And I'm excited to be talking about one of my favorite topics, the gut, with Dr. Cheryl Burdette. We are going to discuss what is leaky gut, how to test for it, and the role of food sensitivities in our health, including our intestinal health, as well as the role of food sensitivities in autoimmune diseases and other chronic diseases. Dr. Cheryl Burdette is a naturopathic doctor. She graduated from Bastyr University in 2001. She completed her residency at Cancer Treatment Centers of America and the Family Health and Wellness Center. She opened her practice at the Progressive Medical Center in Atlanta, and she consulted at Metametrics Labs. She then went on to start Dunwoody Labs, where she is currently the chief medical director, and she is also a clinical director for Zymogen nutritional supplements. Dr. Burdette, thanks for joining me today.
Thanks so much for having me. I appreciate being here.
Excellent. So can you explain what leaky gut is and why we should care about it?
Leaky gut is really one of the frontiers to shifting the way that we treat chronic disease in America. And while standard of care medicine has some very good approaches for acute care, if you break an arm or you have the type of acute infection where you need IV antibiotics, those things we know that we have some good tools for and that we're able to work with quite well. However, when we move into the realm of chronic disease, things like diabetes or osteoarthritis or fatigue, this is an area where we don't have all the answers, where we're not really necessarily satisfied with the approach that's offered. And so when we begin to think about chronic conditions, really at the root of many chronic conditions is inflammation. And so when we peel back one more layer of the onion and think about, well, where does inflammation come from? Much inflammation throughout the body starts in the gut. So when we think about the gut, if I were to stretch out someone's gut, the inside linings of their intestines, that would cover something the size of a tennis court. Now, something that's that large is shoved inside of us and then has good bacteria and bad bacteria that are constantly battling. This is where we interface with foods and things from the outside environment. And so when the gut is not interfacing correctly, it can create inflammation. And maybe we used to think that that inflammation, you would feel it in the gut, it would stay in the gut. What we've now learned is that gut-based inflammation creates a systemic effect as well and can be responsible for the fatigue, for the weight gain, for the osteoarthritis. So by understanding the gut and leaky gut, we can understand better how to control inflammation. The more we decrease inflammation, the more we're able to decrease many of the chronic conditions out there.
And this gut, the lining, even though it's huge and you can stretch it out over a tennis court, the lining is only one cell thick.
Absolutely. So it's trying to do this enormous job, and it's already be a battle that's hard to fight anyway. And then add to that, you're one cell thick, and you've got to turn over every 3 days. You've got to reproduce that cell. And so if the nutrition's not right, if there's too much of an assault because of bad bacteria, it's very easy to get behind within the gut-based health. And once you're behind, you're on your way towards inflammation. And that inflammation can drive many conditions out there. People will think, oh, inflammation, pain, like I sprained my ankle, it hurt. And yes, that's a type of inflammation. But we can have inflammation that starts in the gut that we even measure in the blood, looking at things like C-reactive protein that tell us about inflammation in the rest of the body. It's a risk factor for heart disease. It's a risk factor in terms of increasing risk of stroke. It's an inflammatory marker, but you don't feel it. And even though it's a cardiovascular marker, it starts in the gut. So just because you don't feel gut-based pain doesn't mean you don't have gut-based inflammation. What we now realize is gut-based inflammation can even contribute to things like depression or insomnia, as well as gas and bloating.
And this gut barrier is really, this is our protective layer that prevents us from having toxins that are present all over our environment. It's obvious we live in an increasingly toxic world with pesticides and chemicals everywhere and plastics. And, we're constantly bombarded with heavy metals and mercury and bisphenol A in plastics and all these chemicals that can have potentially harmful effects. And our barrier to protect us from all these toxins is our gut lining. So if there's some decreased efficiency or damage to that gut lining, then that's could become a major factor in all these chronic diseases.
Absolutely true. It's our first interface with the outside world. It's where we have a chance to interact with the outside world and absorb nutrients and have the right immune conversation with the outside world, or where it becomes disrupted and we're moved into inflammation. So at the gut lining is where we either decide that we're tolerant or we're inflamed. Many people will think about, oh, my immune system, that's in my blood. I'm going to do a blood draw and look at my white blood cell count. And that's not wrong, but 85% of our immune system actually lines the gut. And the immune system in the gut, because of those toxins that you mentioned, because of the bacteria that you mentioned, the immune system in the gut has to deal with more outside invasion in one day than the systemic immune system sees in our lifetime.
So for years, we would measure gut permeability with the intestinal permeability test with the lactulose mannitol solution. And then after a while, I think a lot of us functional medicine practitioners, we just sort of came to assume, you know what, most people probably have some level of leaky gut. But I see that your Dunwoody Labs has a intestinal barrier function test that includes an assessment of zonulin, which I think a lot of us are at least somewhat familiar with, is a protein that is a marker for leaky gut, but it also measures histamine and diamine oxidase and a couple of other things. Can you tell us about that?
Yeah, absolutely. And I think that you're right, that many times when somebody comes to us and they're sick and they come to us with a chronic condition, we can assume that there is some level of gut-based permeability, that's where some of the inflammation is coming from, either from a food or from a bad bacteria or a bad yeast, what's called dysbiosis. And so that's true. So many times we might choose to do some treatment first, and then we might, if people aren't responding like we would expect them to look at markers. However, when you mention zonulin, absolutely, it's a marker of how leaky the gut is. Zonulin tells what are called tight junctions in the gut to open up. So it's like hitting the garage door button and having the garage door open, and except on the gut lining. And when that occurs, now either food or bugs can leak through intact, and that ignites the immune system. The immune system says, that's foreign, I don't recognize that. And we get into this more inflammatory state. And so when we look at zonulin, we can tell how advanced that is in somebody. We can tell how progressed they are. But if we look to some of the original research that Alessio Fasano did out of Harvard, he says that if we were looking at zonulin even preventatively, we would see it begin to go up before there was even pathology. And so he talks about how you have to have leaky gut first, and then that's what causes the inflammation to turn on the genetics to cause pathology to express itself. So while we might assume that many people have some level of leaky gut, zonulin tells us how advanced they are, and then that tells us as clinicians how aggressive we need to be with our treatment. How many CFUs of probiotics? Do we need 5 grams of glutamine or 10 grams of glutamine? And so we can use this to gauge our therapies, and then also to be able to say, all right, now your gut lining's back intact. Now is a good time to back down some supplements or maybe reintroduce some foods. So it gives us some clinical guidance.
Now, we recently had a discussion on our functional medicine discussion group of Santa Monica Facebook page about the controversy related to measuring zonulin and zonulin being measured in the serum. There's some papers that indicate it's not really an accurate measure. Some labs are measuring zonulin in stool. You can also measure zonulin antigens, right? And so there's some controversy. What do you think about, how accurate is measuring zonulin in the serum?
The reason that we chose to look at zonulin in the serum is because that's where the bulk of the research is. If I go to PubMed, where the peer-reviewed research is, what I will find is the majority of the studies are done on zonulin in the serum. And when you look at those studies, whether or not we're talking diabetes or autoimmunity, you saw consistency in terms of measurement, regardless of time of day and regardless of what somebody has eaten. Now, that's not to say that other methods aren't reliable as well, like looking at zonulin antibodies or looking at it at the stool, or even biopsying the gut lining. That's another way to get zonulin. It's just a pretty invasive way. But what we did is we looked to see where was the bulk of the research. There are literally hundreds of studies with this methodology, and then we really mimicked that same methodology that was done by Alessio Fasano, that researcher out of Harvard that's really popularized zonulin around celiac disease and sensitivities.
Yeah, there was that classic paper that he published in, what was it, Science Magazine or?
Yeah, Scientific American.
Scientific American.
Yeah,
that's right.
Absolutely. Those graphs are burned in my head for forever. Yeah, there's a leaky gut.
Yeah. So your gut barrier intestinal barrier function test also measures diamine oxidase. Can you explain what that is and its importance?
Yeah, so as practitioners, when we find something that really helps elucidate a pattern in a patient and really helps us to see what's going on with them and how to treat them effectively, we certainly get excited about using it. And that's how I felt about zonulin, and in fact thought, here's the end all and the be all in terms of leaky gut. If the gut's permeable, zonulin will be elevated. I'll be able to track it, and it'll help me with treatment. And then I would find people who presented with symptoms of leaky gut, but you didn't always see zonulin elevated. And so what that led me to do was to do more research and to think about what's out there. And so while we can have a zonulin-mediated leaky gut, zonulin opening up those doors to make the gut more leaky, it's not the only way we get leaky. So another way that the gut can become leaky is, for example, non-steroidal anti-inflammatory drugs, so NSAIDs. And if you use NSAIDs or you overuse them, it can cause the gut lining to be damaged. You can even ulcerate. That's a pretty leaky gut by the time you get an ulcer. However, it's just not zonulin mediated. That type of leaky gut happened because of just damage and atrophy and wearing down the lining. And so diamine oxidase, it's made in the fingertips of the microvilli. It's made in the lining. And so as we have more damage and wear and tear, we make less diamine oxidase. So we can use diamine oxidase as a marker of how mature that mucosal lining is. How much is that one cell holding up? So we can use it to see the functional health of the lining. And it gives us one more way to assess leaky gut. Another interesting thing about it is it's the enzyme that degrades histamine. So when people have low diamine oxidase, not only does that tell us if their gut lining is more worn down, but it also tells us they're not going to handle histamine as well. So foods that they're eating that create histamine, but some foods just have high levels of histamine in them. Tomatoes or avocados, a glass of red wine is a beautiful way to deliver a large dose of histamine. And so people that have low diamine oxidase, what they'll find is they do a food sensitivity test, they do a food allergy test, and they go, wow, well, it doesn't seem like these are the foods that bother me. Well, it might not be that the test is wrong, but it's not that they're having an allergic response. It's that they don't have diamine oxidase anymore. It's that they can't handle high histamine foods. So putting them on a low histamine diet then becomes the therapy that's most beneficial. And so it guides us into a different way that you have leaky gut and also into other treatments that might be useful as well.
So it's interesting. I noticed, and it seems to be a big trend right now in the functional medicine gut community, that you have these patients who don't respond to the typical treatments for SIBO and dysbiosis, and then you experiment with a low histamine diet, and they end up doing better with that. And so it sounds like from what you're saying in terms of the diamine oxidase being lower as a result of gut damage, that histamine is kind of a secondary effect that could occur to any patient who has damage to their intestinal barrier, rather than just another variant of food allergies.
And that's really well put, because if you don't have the enzyme to break down histamine, now even naturally occurring histamines continue to damage the gut lining. And so you're giving more probiotics, you're doing more therapies towards leaky gut, but that histamine just keeps wearing away at things. And so if we recognize that, and then we begin to use therapies that also degrade histamine as part of our leaky gut treatment, then two things happen. One, a reduction in symptoms and people feel better. But two, the gut lining improves and it begins to plump back up again, and it makes its own diamine oxidase, so people get better and the body does what it should do.
The tricky part, it seems to me as a clinician, if you've got a patient with dysbiosis and basically you're in a treatment phase where you're trying to prune away, excess bacteria that shouldn't be there in the small intestine, or, potentially pathogenic bacteria in the colon, and you've got histamine problems, and the way to resolve the histamine problems is to rebuild the gut, but you're still in the pruning, breaking down, paring back bacteria stage. It's really difficult to try to address that at the same time.
Well, you're spot on, because that bad bacteria can also be another source of histamine. And so it can be a real feed forward for a patient. So sometimes, we need to combine these therapies and not only think about ways to kill off the bacteria or what's creating the histamine, but also even using some of these, you can actually even take the enzyme that degrades histamine, diamine oxidase. And so sometimes we have to start with both. But as you get rid of the bacteria, now you remove one source of irritation, you continue to break down the histamine, you remove another, and eventually we can get these patients back on their feet. But you're right, there are many people out there that are very sensitive, and it's difficult to get them back into balance without feeling worse first. A classic example of that I see are your SIBO patients, small intestinal bacterial overgrowth.
Yeah.
One hallmark of that group is that bacteria looks to be very damaging to the microvilli. So you'll see them so often present with low diamine oxidase as well. If you give diamine oxidase and you do leaky gut treatments and you don't see that improve, then that is a trigger for me to think there's probably SIBO that's keeping them from being able to get well, and we're going to have to go after that too.
Yeah, interesting. Have you found diamine oxidase as a supplement to be effective?
Absolutely, a game changer for people when that's the thing that's off. And it's so disappointing, because, for example, if you're one of those people that just reacts to everything, and you go out and one day you eat the cantaloupe and it hives or headache, and you call your clinician and you go, I know it's not the cantaloupe because I had the cantaloupe 3 days ago. Well, the thing is it actually could be the cantaloupe, even though you didn't react 3 days ago. The difference is, as the cantaloupe ripens and degrades, it creates more histamine. So that cantaloupe is different 3 days later than it was, even though it is the same cantaloupe. And so these patients that tend to have these non-specific reactions, if we were in Europe, it's very common. You measure the blood, you look for low diamine oxidase, and then you say, yes, you have histaminosis, and you get treated appropriately. We don't do it here as regularly. So sadly, it's not as well known, and that's unfortunate, because when diamine oxidase is introduced and that's the thing that's off, it's a game changer for people. So yes, you think about hives or rashes, those kind of histamine things, but don't forget, or our listeners shouldn't forget, that we also have histamine receptors on the heart. We have histamine receptors in the brain. And so you can have an inability to degrade histamine and it can cause an arrhythmia. You can have an inability to degrade histamine and it can cause depression. And so I have seen when this is the thing that is off for people and they treat people with arrhythmias that they couldn't get under control come into range. I can remember a woman, she was a painter and she'd lost range of motion. She wasn't able to paint anymore. When she found her DAO was low, she treated it. It was the first thing that allowed her to move again. So when we can figure this out, and that's the thing for people, it really changes the picture.
What dosage of diamine oxidase have you found to be effective? Is there a range for most people?
So diamine oxidase is one of those that is like enzymes, and so they come in these odd units and measurements that are kind of unique to their own being. And so I'm not remembering the exact units, but the one that I use the most is called HisDAO, and that comes from Zymogen. And the way I'll dose that is I'll do 1 capsule with a small meal and 2 with a larger meal if I'm treating a more aggressive leaky gut. If it's a more moderate leaky gut, even just 1 with your larger meals is enough. Now, if I have somebody who's just off the charts, sensitive to everything, reacts to everything, one of those people that you feel like they would probably do better in a bubble kind of thing, if that's not practical, then I'll go higher because the body makes diamine oxidase. It's very safe. In fact, the person that makes the most diamine oxidase is a pregnant woman because her placenta makes tons of diamine oxidase actually to keep the baby healthy, to keep the baby from being damaged from inflammation. And so when our body makes it, we have a high degree of freedom in terms of safety. So when somebody is more sensitive, I'll have them do even 2 with each meal or something acute, like your lips swell and you took Benadryl and it didn't work, which I had this happen to a colleague at a medical conference. She was just swelling horribly. She'd already done Benadryl, no improvement, continuing to swell. So take 4 HisDAO. She took that and boom, her swelling went down. Or so sometimes like a migraine, if I think it's driven by histamine, I'll have somebody take 4 on the onset and that will keep that from occurring. So a lot of different ways of dosing it, depending on whether or not you're using it kind of acutely or for more of a chronic leaky gut picture.
One of the tricky things that I have found when working with patients that have histamine intolerance or appear to have histamine intolerance is avoiding a situation where there's no foods left to eat. So maybe they come into your office and they're already on some restrictive diet and they're on autoimmune paleo and you put them on low FODMAP and now you take out the, high histamine foods and before you know it, there's only 4 foods left they can eat.
Yeah, it can get tricky. And so having a tool like HisDAO can allow us to say, okay, when you eat a higher histamine food, take one of these to offset that so that you still have something left to eat. And then, working with patients in terms of rotation of foods and freezing leftovers so they don't produce more histamine. But you're right. And so sometimes with these patients that are just so reactive all over the place, I'll even just start with low histamine diet, some HisDAO, and then as they gain a little bit of ground, now pulling some foods back into the diet.
Oh, what was that you said? So if you take your leftovers and you freeze them, you get less histamine. Is that because fermentation leads to more histamine?
Yeah, just general breakdown and degradation. Part of that is creating more histamine. So this is why sometimes people go, well, I ate this food 3 days ago and it was fine. 3 days ago it was fine.
Right. And which is why eating fermented foods for patients dealing with histamine intolerance, even though those are really healthy foods that can build up your, bacteria in your gut, while they're dealing with that may not be appropriate.
Yeah, that's a great point. And when you see something like that, something that should be beneficial for the gut, but it's not, like you mentioned, those fermented foods, they should have good flora and that should be beneficial for us. And when you see that adverse reaction, you go, aha, maybe this is somebody with a histamine intolerance because the good flora is there, but as it fermented, it created histamine and they can't tolerate that part. So I use that even as a little bit of a diagnostic tool.
Okay, cool. So I want to go on to food sensitivity testing. So my experience and some of the colleagues I've spoken to in the functional medicine community, a lot of us have been disappointed with the results we get from food sensitivity testing. And it seems that at least half the time the results come back and they either show no food sensitivities, or, you know, maybe the only food sensitivity is to some food they never eat. And often it'll show no sensitivity, or some of the time it'll show no sensitivity to foods that it appears as though they're having reactions to, like wheat or dairy or corn or peanuts. Sometimes they'll react, the tests will come back and show everything. And so it's really difficult to deal with some of these food sensitivity tests. And so, you know, some of us have decided to just do elimination diets and then test them with foods one after the other as maybe a better way of doing it. But I know there's various ways to measure food sensitivity testing. And I know Cyrex has a very specialized way of conducting their tests. How is your food sensitivity testing at Dunwoody Labs different, and why do you think it may potentially be better or more effective?
Yeah, it's not a surprise to me that as clinicians that we would be a little off-put by food sensitivity testing out there. In fact, that's really was the birth of Dunwoody Labs. Was, as a clinician, what I found is that I would read things in the research and read hundreds of articles about it, but then when I went to go look for it, things like thiamine oxidase, I couldn't find it commercially available. You couldn't get it from someplace like a Quest or a LabCorp. And so really, then Dunwoody Labs was birthed out of a clinician's need, and food sensitivities gets right to that point. One reason that you could be upset and feel like there's not a good match in some of the food sensitivity testing is because when you look at IgG and you look at just the total IgG, you are lumping together antibodies that do some very different things. So IgG total is going to look at subtypes 1, 2, 3, and 4 together, generally speaking. And when you do that, that's unfortunate because types 1, 2, and 3 create a lot of inflammation. They're very good at recruiting complement and other interleukins and causing more of that inflammatory response. However, IgG subtype 4 blocks IgE. It actually blocks allergies, not sensitivities, but blocks allergies from occurring. In fact, if you do allergy desensitization, the whole point of those injections is not to lower that IgE, that allergic response, but it's actually to upregulate an IgG4 response. So IgG4 blocks allergic reactions, whereas IgG subtype 1, 2, and 3 creates more histamine in the body and creates these sensitivities. So if you lump all those together and try to calculate that into one result, it's no wonder that people would feel like it's a mixed result, because absolutely it can be. So at Dunwoody, we look at total IgG, but then we tease out IgG subtype 4 so you can see how much of that is at play there. And then we also look at IgE as well as complement. So complement is a whole nother way that the immune system could react to foods, and complement increases the inflammatory potential to a food 1,000 to 10,000 fold, some of the research says. So when you have IgG, that's just one part, but when you also have complement, complement will bind to that IgG. And when that occurs, I tell patients it's like Wonder Twins activate. That's the inflammatory magic. That pulls all the white, it's like a huge siren going off in the body when those two come together. And so now you pull all the white blood cells to the area, all the interleukins, all the cytokines, and that's how you really create an inflammatory potential. So I'm sure you've had this experience. You're sitting there with a patient and they go, well, it says these are my high ones, but I don't notice that when I eat those foods at all. And this one's a low reaction, but I always get a headache from this. Well, it might be that if there's a low IgG titer, those are those sensitivities, but complement is also present, it amplifies that 1,000-fold. And so by adding complement, by teasing out IgG4, we can look at this as more of an immune system than really just a spot check on one part of the, I mean, it's called an immune system for a reason. There are these multiple players. And so when we can look to see, are you allergic? Is that blocked? Did you become tolerant with IgG4? Are you sensitive? And is that amplified? Now we can really get a more complete clinical picture, and it can help in terms of some of the dissatisfaction of sometimes it's high, sometimes it's low, like Goldilocks, sometimes too hot, sometimes too cold. No, put the immune system together and get it just right.
I've also seen a few labs that test IgA and IgM. I guess there's a lot of different things you can look at.
Yeah, no, I think IgA has some good validity to it. Dunwoody is introducing an IgA, so we'll have one more column. So we'll be
Okay.
5 ways the immune system can react. It tends to, in general, most of the time, be a less inflammatory pathway for people because IgA can't bind complement. So it's not as good at creating an inflammatory response, but it still participates and can certainly drive a lot of gut-based inflammation. So yep, it's one more way the immune system can react. And again, I think this is why clinicians kind of throw these things to the side because, well, if you're only looking at one part, of course you miss the picture.
Can you explain more what complement is and how binding of IgG to complement is a significant factor? I'm not sure that a lot of us are really familiar with this.
Yeah, so in immunology, we have what's called the classic complement cascade, as well as the alternative pathway. And these are pathways that evolutionarily our body developed to deal with infection. And so what the body wants to do is we make these antibodies and they're a remembered response. They should be a learned response to a bug. And so you made an IgG and now you're ready the next time that bacteria comes or that virus comes. And so our body said, we don't want to die from these things. So if it's if it's a really bad bug, then not only will we make an antibody response, but we'll make complement as well. And so now when we see that guy again, we got double the weapons, we got double the machinery. And so complement binding to IgG drives more of that inflammatory reaction. So it was designed to help us overcome bugs to not die from dysentery like would be likely for it to happen to us a couple hundred years ago. However, now with the environment and leaky gut, this leads to immune confusion. The immune system begins to treat food like it's a bug. And so if you've also developed complement to this food as well, you're starting this inflammatory cascade that was designed to keep you dying from dysentery. It's a lot of inflammation. And so it will really amplify what that IgG is able to do. IgG by itself doesn't create a lot of fire, a lot of inflammation. It'll lodge in tissue and damage the inside of a vessel and damage your kidneys, but it doesn't really turn the immune system on. But IgG plus complement is really that siren that ignites the whole process and will create much more inflammation in our patients.
Interesting. And so your lab has a column that measures complement as well as IgG.
Yeah. And so it's clinically meaningful to us as well, too, because if I see a patient that has a lot of complement reactions to foods, yes, we're removing the food, but I'm also using curcuminoids isolated from turmeric because they're very good at downregulating complement. So it gives me other methods of treating as well.
So complement can that be measured as like is that like a inflammatory factor?
Yeah,
Along with
and in
other
fact,
inflammatory markers?
yeah, so just like we can look at IgG specific to foods, you could also look at a total IgG just to see how your immune system is doing there.
Right.
So we look at complement specific to foods, but yeah, you can look at complement in general too, a total complement like C3 or C4, and that's very routinely done in the autoimmune world.
Really? Okay.
Yeah.
C3 and C4.
So now you're figuring out what's causing the upregulation of it.
Now, in terms of testing food sensitivity for wheat, that obviously is a big topic for us because of the gluten issue. And one of the labs has like 15 different proteins they measure to test sensitivity of wheat. And that seems to be a more comprehensive way. What do you think about, that way of looking at wheat instead of just looking at alpha gliadin?
Yeah, I think it definitely has clinical value. For me, it's not a starting point because what I want to see first is across all the foods, which ones are you most reactive to? So I'll start there in terms of looking at how to change the diet. And then if I see some gluten, or if it's an autoimmune condition and I think, well, maybe there's something here missed and I really think there's a gluten issue, now I'll dig deeper into that one area and look at some of those cross reactions. But I do think in autoimmune conditions in particular, where we know gluten can be so inflammatory to the immune system, doing something like that has value. Interestingly, that zonulin that we talked about before, not only does it go up in response to bacteria that's creating a leaky gut, but it goes up in response to gluten as well. So if we see an elevated zonulin, we know for sure that this patient needs to take gluten out and that gluten is a part of their gut-based permeability.
Besides taking some of these foods out, have you found that enzymes, there's specialized enzymes now for gluten and dairy and things like that. Have you found those to be effective as part of your treatment protocol?
Yeah, I do think that they are useful in terms of breaking down the gluten, creating less inflammation. Now, I probably use them a little less often, only because I'm really trying to get the patient just to take the gluten out. But let's face it,
Of course.
we don't always know. You're going to go out to eat. Things can slip in there. Now we're moving into the holiday season. Yes,
Yep.
I think it's smart to walk around with some enzymes that will degrade gluten a little bit better and walk around with some Histi-AO, that supplement that also breaks down histamine too. So if we eat something that we think that could be offending to us, we shut down the inflammation before it even begins.
Great. So I think this has been an interesting discussion, Dr. Burdette. I appreciate you spending some time with me and the the rational wellness practitioners and listeners. So for our listeners who would like to get a hold of you, what's the best way for them to contact you?
Yeah, please just reach out to me at info@dunwoodylabs.com. And that will come right to me and be able to talk to you about any patient concerns, if you have questions about testing, that kind of thing. I'm a clinician first. That's the birth of the lab. So usually able to talk to you in terms of treatments and things that I've seen work and things that other colleagues have seen work as well.
Are you still working as a clinician, or are you pretty much? Yeah.
Yeah. So I am at Progressive Medical, and I am there on the educational team. I have 5 naturopathic residents, and so doing grand rounds and case reviews and very involved in terms of shaping curriculum and protocol at Progressive Medical. There's about 30 of us all there practicing under one roof together.
Oh, wow. Very exciting. Okay. Thank you, Dr. Burdette. Hope to talk to you in the future.
Yeah, thanks so much for having me.